everyone. We have Dr. Jyothis from Trivandrum.
Yeah.
And also with us, we have Dr. Ashvin. He is practicing in Gujarat. Well, we are very glad to have both of you with us.
Yeah.
I'll be asking you some very simple questions for our viewers to understand the concept of kidney stone management. Well, the very first question is very simple. Why do you think the number of cases when we talk about kidney stones are on the high rise
Definitely,
side?
definitely, definitely. Because, when I was studying for my MBBS and MS or even MCH, I studied in one of the biggest medical colleges at the time, Trivandrum Medical College. See, the number of stone patients coming to the hospital those days in urology OP, where it was only urology OP in the South Kerala at those times. There were 5 to 6 cases per day in a medical college. But now, in hospital where I work, it's a private hospital. It's one among the 20 hospitals in Trivandrum. I see more than these number of patients in a private sector hospital. And just imagine what will be the number of patients you see in a medical college, maybe 10 folds of what I see. So the number of patients are definitely are going up. See, what I feel is because more and more people, we are working, we're going out, we're taking less water consumption, then exposure to sun, then we have all become rich. We are eating more protein food. In Kerala, we just eat chicken or meat. Everybody is eating chicken, meat, and we got another stuff called barota, which is made up of this maida. And these three things, I always say, the more chicken you eat, more stones you come. That means more proteins are taken, more calcium is taken, less water is taken. We're venturing out. Even ladies, olden days, the number of stone patients among ladies used to be much less. But now the ladies are also coming with more and more ladies are coming with stones. Possibly, I feel it is our way of living, our eating, even our culture. We are used to our old culture and ethics. Definitely, we would have had less number of stones.
True.
That is my sort of idea. What's your idea, sir?
So in Gujarat also the temperature of the climate, the temperature gradually increases. So more and more heat exposure people have. They take life is also they are more busy. So they drink less water. Main thing is that. Another thing is
So water
Dr.
is
says so water is the main thing. Restriction of the less you take less water, you will have more and more stones.
Sumptuosity. That is, we are becoming rich.
Yeah.
This is a disease of richness.
Richness, actually.
Richness.
Well, to be precise, I wanted to ask you, what has been the most challenging case of stone you have ever seen in your entire career? Were there any?
Yes, there are stones. Even there was a patient who just landed up just before I came
Okay.
from Trivandrum, because this gentleman had a shrunken kidney on one side. Possibly he had stones earlier, and that destroyed his kidney on the right side. And the only other kidney was the left kidney, and the left kidney was also blocked with a stone at the mid ureter, and he went in for pyelonephrosis and sepsis, urosepsis. So he was brought in such a bad shape to the hospital without much of blood pressure was very low, patient was toxic, his medical parameters were all high, and he was in very bad urosepsis. So at the middle of the night, we were forced to do a stenting for him. So when he came to the theatre, the anesthetist said, keep your fingers crossed. I will give anesthesia, but I cannot guarantee anything. I'll give anesthesia, but I also said, I'll try with the stenting without any anesthesia. I tried to put in a stent. Unfortunately, the stent didn't go. So we were forced to convert to GA, general anesthesia. So after the anesthesia, this gentleman was not having recordable blood pressure. He was such a bad shape, and he was put on life support and inotropic drugs to raise the blood pressure. It took 2 to 3 days for the blood pressure to come up. But fortunately, God's grace, not our grace, it's a God's grace, this gentleman recovered. He walked back. There's a recent experience.
Any such cases on your side, sir?
So I practice since more than 20 years, and I usually do 4 to 5 cases a day. But still, every case we think it is a simple, but not like this.
True.
Out of 10, 100, 1 or 2 cases are there. You go, you say it's a just 5 minute to task, but
It's
it
not like
ends up in the
And
difficult
that's
case.
it.
But some of the cases, like they have raised creatinine, kidney malfunction in that, or they have infection. We have to take fast decisions, and we have to treat them rapidly.
Well, in your views, what precaution we can take as in to avoid any kidney stones, and also
Yeah.
if we
So
had
that's
one,
a wonderful question. See,
Yeah.
already both of us have said water, water,
Water,
water.
water.
So you drink about 2 liters, more than 2 liters of water a day, and make sure that your urine color is clear all the time.
Okay.
When look at your urine. If the urine is dark, that means you are not taking enough water.
Okay.
If the urine is light, that means you are taking enough water. And take a cup of water in the night also. When you get up to pass urine at night, take another glass of water.
Okay.
That's one thing let's keep your body well hydrated. The second thing is you reduce your highly salted food to be reduced. That the sodium load should be reduced. We don't say you reduce your sodium. That's a bad thing. Unwanted salt like pickles, puppets, mixtures. Then dry fish. We are in Kerala. We take a lot of dry fish. Dry fishes, highly salted food to be avoided. Then calcium, of course, you take enough calcium, but not more calcium. That means
True.
all the non-vegetarian foodstuffs should be controlled, regulated. I always use the word
We
regulated.
should not avoid that.
How can we avoid it?
Yeah.
We are basically non-veg in our part of the country,
Yes.
and without eating fish,
We can regulate.
our day doesn't stop without a fish.
True.
So we can take, but at a reduced rate. These are and good exercise. If you take good exercise, walking, what happens is your bones, the calcium will deposit to the bone, and less calcium will come to the urine, and then exported to sunshine. That is, you need enough vitamin D, vitamin D3. When there is a deficiency of vitamin D3, again that can produce calcium. So these are the small things which I say, which is of importance in preventing calculus.
Well, what are the go-to kidney stone management solutions
Pardon?
which are available? What are your go-to management solutions?
What are?
What are your go-to management
What are the
solutions? The
options of the kidney
stone
stones?
management.
See, we have in the hospital where we are
Yeah.
working. In a nutshell, I say last 10 years, let us put it last 5 years, we have never had an opportunity to open a patient for a stone. So we are managing most of the cases, 99% of cases, endoscopically. We got everything there from laser to percutaneous to ureteroscope to flexible ureteroscope. Facilities are there in India. Everywhere now facilities are available. We are all almost alike. We are all almost, we are alike in that manner.
Yes, well, I wanted to ask you, what do you think is going to be the next big breakthrough when it comes to kidney stone domain? The next big breakthrough.
I should say,
Yeah.
in the future, we should be able to prevent more kidney stones. Some drug, medications, or better understanding of the physiology will result in prevention prevention is better than cure. And of course, the technology keeps on increasing. Technology is going up. When I studied, we had nothing. I had only a cystoscope, and even resectoscopes were very rare those days in '83.
Any myths we have when we talk about kidney stones?
Pardon?
Any myths we have which needs to be busted?
Misses always happen. If you are practicing enough number of, if you're doing enough number of cases, misses do happen. When my boss used to say, if you say all your cases have gone through the right way without any complications, you are lying. Either you are not done anything or you are lying.
True.
If you are really a man who does surgery, the complications are bound to happen. That is statistics.
Thank you so much, gentlemen, for your time. And you have a call coming again and again.